This week on Diabetes Connections, during his final exams at Georgia Tech, Jonathan Fitch had a seizure. He was fine, but it was a frightening wake-up call that he says showed him managing T1D reactively wasn't enough. An industrial engineering student, he pivoted to creating an all-in-one app designed to help people stay ahead of diabetes called GlucoSense. How does it work and what does it do? This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. I am always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. I am your host, Stacey Sims. My son has lived with type 1 since he was 23 months old. He is now 20. My husband has type 2. I do not have diabetes, but I have a background in broadcasting. And that is how you get the podcast. Quick update on our Mom's Night Out events. We're going to be opening registration for Mom's Night Out Phoenix. That's happening in October. In fact, as this episode goes live, registration may be open now. You'll get an email if you are signed up for our email list in our weekly newsletter. If you signed up for our city-specific emails, if you're on the Phoenix list, you already got an email. You can go to the main Mom's Night Out page to sign up for those city-specific alerts and emails, or just get on the interest list because we're looking ahead to 2026. We're going to have those cities, I would say, relatively soon. It is not easy picking where to go. I love the emails. Keep them coming to where we should go next. There's a lot of passion out there. There's a lot of need. I'm thrilled to be doing this. It's so much fun. I should also mention that we have announced our speaker for Minneapolis, which is taking place in September. And our opening keynote speaker for that is Patrick Murtis. Might be a familiar name, or maybe you've heard of Project 50 in 50. A couple of years ago, Patrick and his friend Michael Shelver, both of them live with type 1, did the 50 in 50, and that is climbing to the highest peak in every state, all 50 states, in 50 days. It was quite the adventure, and they have done more since then, including some crazy challenge in the Grand Canyon, rim to rim to rim, I think it's called. So Patrick's going to share his adventures. He was also one of the counselors at Benny's diabetes camp. And I don't know that he'll be telling stories about that, but, you know, Benny was always an exciting camper. I'll put it that way. Forgot a few things. Patrick had to help him out a few times. Never a dull moment with us. So that's the Mom's Night Out update. I also want to give a quick update about reaction to the last episode. Our last episode was all about 504 plans with the American Diabetes Association. Most of the episode was about making sure you understand what a 504 plan is and is not. This is the plan that gives kids with disabilities equal access in public schools, but she also went into what can happen in private schools, religious schools, preschools. Very valuable information refresher if you think you know 504 plans, or if you're new, got to listen to that. Make sure you understand how to go into your child's school and deal with this situation. But of course, we spent the last part of the episode talking about potential changes to the Department of Education, potential changes because of a lawsuit brought by 17 state attorneys general. That lawsuit could pick up again, possibly this month. Later this month, they're having hearings again on that. All of that to say, I got a couple of really angry emails and Facebook comments about the episode. Got to say, I don't get a lot of angry emails anymore. I was surprised, maybe I shouldn't have been, people taking the existence of the episode as criticism from me to President Trump, to MAGA policies, and everybody commented, very interesting, said the same thing at the end, which was, why don't you be more positive? Gotta tell you, even through the anger in those emails, nobody was rude, nobody was nasty. I don't want to misrepresent this. I did respond to everybody. I will just say here that my goal with Diabetes Connections, as it has been from day one of June of 2015, has been to inform and inspire, to educate, to bring news. I'm a journalist by background, to bring information that is relevant to this community to as wide an audience as possible. And we will continue to do that. I don't care what side of the aisle you are on. Diabetes does not discriminate along political lines. I am putting out information that I think is relevant to everybody in the community. Let me know what you think. Love to hear from you about any of the topics we cover. And as an old radio talk show host friend of mine used to say, agreement is not required. Okay. I met this week's guest, Jonathan Fitch, at our Atlanta event earlier this year. He was there to talk about his experience at the amazing Camp Kudzu. Love that camp. But as he was speaking, I knew you would want to know more about his app, GlucoSense. It is early days here, but it sounds really interesting. One of the most unique features of GlucoSense is the glucose score. Rather than time in range or A1C, this score is 1 to 10. And it's supposed to be a clear, easy to understand snapshot of your overall blood sugar management. I bring that up here because at the beginning of the interview, Jonathan is talking about his score and his numbers, and I want you to know what he's talking about. But I will let him explain everything right after this. One of the things we love the most about the Dexcom G6 is that it helped Benny become more independent, but maybe not in the way you're thinking. I mean, remote monitoring using the Dexcom Share and Follow let us be more confident letting him do more away from home with friends or at camp. But just the design change of G6 meant Benny could use one hand to insert the sensor. He was 14. He didn't want our help anymore. It was perfect timing. Dexcom G7 is even more simple to use and gives effortless diabetes management that fits into your lifestyle without the disruptions. Ease of use helps everybody, and I'm grateful the Dexcom product designers kept that in mind with G7. Learn more, go to diabetes-connections.com and click on the Dexcom logo. Jonathan, welcome to Diabetes Connections. I'm excited to learn more about this. Thanks for being here.
Thanks for having me. Excited to talk and share a bit about what we're doing and our background.
Let's jump right in. Tell me what GlucoSense is. We'll get into the details for sure, but kind of high level.
Well, it's funny enough, somebody today posted from Mom's Night Out who met us and downloaded the app. He said it's like Aura, but for your diabetes. And pretty simple pitch line. That's truly what it is. It's your companion in your day to day. It simplifies everything that you think about as a type 1 diabetic or type 2 and brings it back to a single number you can work to improve each day. It's your personal baseline with personal targets, and everything you do gets an insight, whether that's a meal, a run, sleep, or the day. We turn your data back into plain English.
All right. But we need to be clear. It's not a ring like Aura, correct?
No. It's a software platform that connects to any of your devices. So Dexcom, Libre, Aura, Whoop, Fitbit, Apple Watch, all of those, just sign into your accounts and it all comes into GlucoSense.
So what would I use this for day to day? In other words, I wear an Omnipod 5 and a Dexcom, and then I attach GlucoSense to it. Is the expectation that I would act on the data that I see? Does it automate anything? Kind of dig in for me.
Yeah. So the best way to think about it is think of having a personal data scientist that does all the processing and thinking of your data for you, and then turns it back into like a summary that you can go, oh, that makes sense. I'll do this. That's kind of what it's supposed to do. So an easy example I can give is I woke up the other morning and I had a glucose score of 4, which for me is pretty low. I usually get about 7s every day, which is 7 and above, you're doing great. So that glucose score of 4 came a morning when I woke up at 100, but my pump had pulled me down at some point in the middle of the night. I think I had like pizza or something. And then I had this big spike after I went to bed. And so I woke up, I got 8 hours of sleep, but I felt terrible. My pump brought me down from like 280 to 100. So wake up, look at Dexcom. Oh, sweet. My blood sugar is fine. And then I see the GlucoSense score and I'm like, oh, shoot, I'm a 4. So instead of having carbs for breakfast or jumping into my day, thinking that I had enough sleep, the fact is I'm not really well recovered. I was able to go, okay, I'm going to cut back on breakfast. I'm going to make some better decisions today. And we're going to get this one number up a little bit. So I'm not staring at the Dexcom chart. I don't eat that bowl of Cheerios that skyrockets me because my body's not ready for it. I just live a simpler life because I have one source of truth. If I'm below my baseline, I make better decisions. If I'm at my baseline, it's my day to lose and I can kind of go about it how I want.
All right. I took you ahead a little bit, though. We got to explain what the score is, what that 4 and that 7 mean.
Yes. The glucose score, the providers who we work with have a really great way of explaining it to their patients. We have some people think that it's a scale, and sure, it kind of extrapolates to 1 to 10, but that's not how it should be perceived. When you sign up for GlucoSense, you find your baseline. You can sign up and have all 3s. It means there's room for improvement, and you can work each day to get to a 4. If you sign up and you have 4s, you work each day to get to a 5. I've obviously built GlucoSense and been using it. I'm around a 7. So when I fall into the 6 territory, I'm like, something's not right. I either need to talk to my provider. Maybe my Omnipods aren't working right. Maybe my basal needs to change. But it cuts through all the noise. I don't need to think about stability. I don't need to think about time and range. I don't need to think about my average blood sugar because it's one number encompasses everything. So use glucose score to find your baseline and use that as your goal for each day. Some people get nines and tens, and I don't know if they're real people, but they do. I have a kid who I mentor, and he's always getting nines, and it's just like you roll your eyes at it, like how that's just not me. And I feel like I could eat no carbs in a day on an insulin pump and still not get a nine. But that's not the point. The point is to see where you're at and only improve against yourself.
So that score is taking into account everything from time and range to sleep to, I know that there's a better word for this, but I'm going to say spikes, ups and downs, right? You want a standard
Yeah,
deviation, maybe.
that's a great point, and I'd love to dive into it.
Oh, well, but before we do,
Yes,
so that number that you've mentioned, that I assume it's a 1 to 10 scale, that is taking in, that's aggregating all the information that we know about diabetes and then giving you that one number.
correct. But we don't actually utilize sleep data to change the score. The score is only based on your blood sugar pattern.
Okay.
So what's really unique with what we've done is we can score any blood sugar chart consistently, whether it's for an event, a day, a week. Like for the first time, it's no longer subjective. This good? Is that good? You and a provider can talk about it and say, this chart is A6. Like nobody else has figured that out. That's really what makes GlucoSense unique and consistent and how we're able to provide insights because we understand how different blood sugar behaviors score, whether it's a really high blood or low, et cetera.
When you were talking about sleep, you just knew that you didn't get a good night's sleep because your blood glucose had spiked and then plummeted.
Well, I got 8 hours of sleep. That was tracked by the Aura. And we use the timestamps of your sleep to say, okay, your glucose score during sleep was a 4.
Got it. Okay,
And
that makes sense. Yeah.
yeah. And one thing I'll add is every day is kind of a new day. So at midnight, your glucose score resets. When you wake up, kind of the first third of your day builds the foundation of what your glucose score is going to be for the day. And you just work against that to improve. Every day is a new opportunity, and it's kind of to celebrate the small wins.
You got excited when I said standard deviation, which doesn't happen very often. What did you want to dig in on that piece of information?
It doesn't work. It's a fallacy to think standard deviation works for diabetes, specifically type 1 diabetes. And my background's data science and computer science at tech, as industrial engineering is my major. But this doesn't require that degree to, well, maybe it does because there's lots of research in people trying to fit a square peg into a round hole, whatever the saying is. But to put it in layman's terms, if you use standard deviation for anything, you're looking at how a number goes above and below about a common baseline. And that's your standard deviation metric. It works for most scenarios. But with diabetes, if you're supposed to be 100 and you can operate each day at 250, 300, not that you should, but
people can.
You're not exactly, but you can have a seizure below 60. You're not going as low as you do high, specifically in the sense of I go low, I come right back up. But if I go high, it can take 4 hours to come back down. So you spend a lot more time high than you do low. So you're not actually going up and down about a common number. That number is substantially closer to your lows, and it loses a lot of meaning because of that. I hope that's simple.
Listen, Jonathan, I understood it. I'm not a math person. We have never used standard deviation for anything in this house. Now I feel like a genius for not having used it. But that really did make a lot of sense. I mean, I'm kidding around. I'm joking a little, but that really makes a lot of sense. Before we go further with GlucoSense, you have mentioned a couple times, obviously, you live with type 1. Let's talk about you a little bit and how all this came to be. How old were you when you were diagnosed? Can you tell us a little bit about that?
Yeah, so I was 11. It was 8 days after my birthday. I had just gotten back from a big family trip overseas, and I was the shy kid that wouldn't take their shirt off at a public pool. And I was now like peeing on tree or peeing like at the trees on the side of a highway.
Got it.
It's like all the time. And my parents were like, that kid is not okay. He is not like himself. So back then it was Skype. We Skyped the doctor, and there was like a week and a half left in the trip. And he said, don't cut the trip short, but come in and see us as soon as you get back. When we got back, my dad took me to my pediatrician, and my blood was 532 and type 1 diabetes.
Wow.
My best friend at the time actually was type 1. So I wasn't too emotional, maybe because my blood was 532. But I remember my dad being incredibly emotional. I can't imagine all the thoughts that went through his head when it happened. But I actually have a positive memory of the 3 days I spent at the hospital being taught about diabetes. My dad set up for me to meet the helicopter team at a Children's Healthcare of Atlanta because my room looked right out of the helipad. And I was fascinated with aviation as a kid. And so you like went and camped out in the cafeteria, came back to the room, was like, hey, I've got a surprise for you. And then heli team showed up, took me out to the
Oh, that's
helicopter. And
great. Wow.
so turned something that's probably not such a positive experience for a lot of people into something that's I look back at with positive memories.
Wow. That's really interesting that your good friend had type 1 as well. So I know it's tough to remember when you were 11 years old, but do you remember saying, like, I already know a little bit about this?
Yeah, so in first grade, her name's Mackie, and I remember Mackie got diagnosed in first grade. For 11 is pretty much, it was the summer between fourth and fifth grade for me. But I remember Mackie's mom coming in and reading a book to the class on type 1 diabetes. And Mackie and I were very close, so I always saw her test her blood sugar and take injections. And when she got her pump, so I'd seen a lot of it. We had birthday parties together. Like that's how close we were.
Wow.
Our birthdays are a week apart. That definitely lightened the brunt of being diagnosed. I'd say I remember it quite well being friends with her and being observant to everything she's doing.
There's probably a lot to the story between age 11 and GlucoSense. I don't want to skip too much around, but with limited time. How did you then decide later on to begin the work that became GlucoSense? Right back to our conversation. But first, Diabetes Connections is brought to you by Omnipod. It used to be that you would have to choose between an automated insulin delivery system and the freedom of a tubeless device. Now, with Omnipod 5, you can have the best of both worlds all in one. Omnipod 5 adapts with every pod change to meet your unique insulin needs and adjusts insulin using a customized target glucose, not a range. If you're ready to ditch the multiple daily injections or send your tubed pump packing, there's never been a better time. They'll even check your insurance coverage for you. Fill out the quick online form, see if you're eligible for a free trial. Go to diabetes-connections.com and click on the Omnipod logo. For full safety risk information and free trial terms and conditions, visit omnipod.com/diabetesconnections.
For me, founding GlucoSense was because of an experience I had during college finals. To preface, before I dive into that, I've always had a pretty decent A1C, 6.5 or less, sometimes in the fives. And, you go to the endocrinologist, they look at your charts, they see your A1C, and it's like, oh, you're doing great. In my past 3 months, I'm like, cut out carbs because I feel like every time I eat carbs, I go high. Even though I put it into the pump, I'm doing everything right. He's like, well, your charts look great. And I'm like, you're missing the point. Day to day, I'm struggling. It feels like my blood sugars are fine, but that's because I'm not doing things to make them go high. I'm being super careful about going low, and it's exhausting and it's burning me out. Diabetes burnout's a real thing. And one big pillar we're trying to tackle with GlucoSense. And I felt like there was always this break between what you get to discuss with the provider and what they have transparency into and how you actually manage your diabetes day to day. So outside of being this clinical standards, perfect diabetic with these great blood sugars and great A1C, I ended up having a seizure during finals at Tech. And it was one of my harder classes. I stayed up all night studying. I didn't do anything crazy from a management perspective. I just was stressed, insulin resistant because of the cortisol, blah, blah, blah. And I took the final. I was somewhere around 300. It wasn't coming down throughout the day. So I figured I'd deal with it after the final. I know you can use exemption accommodations for diabetes, and I had them, but it was my last final and I stayed up all night and I just wanted it done with. But after the final, my pump recommended a correction dose. Didn't rage bolus, didn't take anything else. Just click, click, click. And then in 45 minutes, I went from 300 to under 40 in less than 45 minutes. I got back to the fraternity house. I was taking a nap as soon as I got back. So exhausted. And I woke up to Dexcom blaring, rapid drop rate, urgent low. I had 60 seconds before the seizure. I had some candy in a bin in my room. When I woke up, my vision was starting to come in and out. And I ate the candy, and that's what brought me out of the seizure. It was that experience. It was like, why are we so reactive in diabetes management? Why are there no tools that are looking at the fact that you didn't sleep last night? Or when you wake up in the morning that your glucose score is a 4, let's be careful today. Because maybe I wouldn't have taken the nap and paid more attention. or switch to an injection, I would have been more on top of the management because I would have had something to tell me today's going to be a bit more difficult or today's not going great. And that's ultimately where GlucoSense is now and what in the message we're trying to focus on and solve for people. It's how do we make your day to day easier so you don't have to be so reactive, so you don't have to make the 180 decisions a day? How can we give you a tool that can let you make better but fewer decisions?
Having an idea is one thing. Creating a fully formed app and working with companies and doing everything you have to do now is something entirely different. I'm always curious. Again, that would be like a 2-hour conversation on how I built that. That's not what I'm going for here. How did you then, you have the idea. Can you take me through a little bit of how that becomes something like what you have now? Did you get a team? Are you working with a lot of people? I don't know. Whatever you want to share on that, Jonathan.
Sure, I'll try to keep it a high level for the sake of time, but I actually got to do GlucoSense as a capstone at Georgia Tech. And there's a startup incubator here. So went through the startup incubator. At the time, I'd actually had another company called Next Gen Integration, which was a college business for me, but pretty much grew it to like 7 figures while I was a full-time student, had half the fraternity working for me. And it was awesome. And it taught me a lot about business and being an entrepreneur and being type 1. It's interesting. My parents are always like, you should go the corporate route. And I think they saw it as a safe option, great health insurance benefits. To me, I'm like, if I get fired, I lose my health insurance. But it's my responsibility to make sure I have clients of mine and I provide a good enough service. And if I keep doing that, I'll always have an income. So that's why I like the path of being an entrepreneur and controlling my circumstances, the easiest way to put it. And I had a mentor, or he's still a mentor. He was like, look, you're going to fail at both if you try to do, he calls GlucoSense diabetes. He goes, if you try to do diabetes and your other company, you're going to fail at both. You have to pick one and get rid of the other. And I'll help you with whichever way you choose. But I think the diabetes is the bigger opportunity. Probably going to be pretty hard, but it is. And I was also kind of ready to move on from what I'd been doing. I wanted to chase bigger goals. And so he helped me sell my first company and did that successfully. And the summer after I graduated, we incorporated GlucoSense and became a company. We raised money and we've been dealing with healthcare bureaucracy since.
I was just about to ask. So it's one thing to get people to sign up for apps or convince companies perhaps that this is something that their employees should look at. But dealing with healthcare companies, not something that I have done, but I have talked to a lot of people in the 10 years of this podcast who are trying to navigate this system. I'm going to imagine it's pretty hard, but you are doing it. Is that the biggest hurdle?
At times, it feels like it's a hurdle you can't even overcome. It makes sense why healthcare innovation is the way it is, and the system doesn't seem to change patient outcomes. If we just look at the diabetes process on its own, there are like 5 CPT codes your doctor bills, and those are set every year, and they really haven't changed much. Essentially, you go to the doctor, they bill for the first 20 minutes, the second 20 minutes, reviewing 16 days of your CGM data. But none of that had to do with getting your A1C from 9.5 to a 7 or making each day easier. The insurance company will pay for the insulin pump because there's clinical data that shows that it can help bring down A1C. And this is a whole separate rabbit hole, but I'll just caveat that they do, but they're in the margin of errors. Continuous glucose monitors are actually the most likely tool to bring a patient's A1C down. Insulin pumps make diabetes management a bit easier, but also there are studies that show that it can lead to being a floppy diabetic, which I'm not just going to make a generalization. Sometimes I'll eat something and because I don't have to take a shot and think about taking a shot, I'll be like, oh shoot, I didn't bolus.
Yeah.
Those are the kind of things that can come from taking for granted an insulin pump. But they're looking at A1C. How do we go from really high to really low? How do we lower our costs? And you're insured on a year-to-year basis. Diabetes isn't a problem today. I could have a 9.5 A1C all year and be fine. Just might not be comfortable everyday living, but you get used to it and that becomes your reality. The health insurer doesn't really care as long as if you're not driving up their costs, like ending up in DKA and going into the ER. The problem's in 20, 30 years when you have retinopathy or neuropathy and these different comorbidities. But the problem is nobody's being paid to solve for that today.
Right.
Like the outcomes are not tied to reimbursements, and it makes being innovative and developing technology very difficult because what the patient asks for, what the patient wants, tools like ours being an example, patients expect their health insurance to pay for. So you can't create a tool like this and go, oh, well, it's $20 a month. But I pay health insurance and that's like $700 a month. And it's a psyche, and there's a lot of research around that. So how do you convince the payer to pay when it only adds more money? You need to show them that you're going to reduce their cost and how much they spend on insulin because you take less insulin, or you reduce their variable cost of an admission to the ER, which is really hard to get an accurate metric on in type 1 diabetes. So I totally went on a tangent.
No, it's great.
Healthcare and chasing these dynamics to build a product that helps the patient, that solves the interest of the provider so they refer it to the patient, to have the clinical validation, even though we get data from our users, people don't download the app or they stop using the app. We know the app's not right. So we make changes, make sure that so new users do use the app. Like that's how today's world works. But the process that we're in is make a product for the patient. Well, how do you get patients to hear about it? You need social media adoption or you need campaigns. Patients typically trust their providers and want recommendations from them on the tools that they should use. How do you get provider buy-in? Well, it depends on the healthcare provider organization. If they're a hospital system, they're not really paid additional salary, not all of them, but a lot of them, not paid an additional salary for meeting with more patients and improving outcomes. They can make more money by doing grants and research. So how do I get a university system or hospital systems buy-in? You write grants and do research that take 8 months to get approval and to write with very low likelihood of being funded. And then you go through that for a couple years. And then they're like, okay, well, we have enough data to make a recommendation of this to our patient. So that's a university and hospital system world. If I go to a private practice, they go, okay, their entire reimbursement is around billing stuff to insurance for those CPT codes. How do I bill insurance more efficiently? Can I bill additional CPT codes? Uphill battle there. And if I need them to spread the word of GlucoSense, and I also have to satisfy their interests of how they make more money, it's a long losing battle for a product like GlucoSense. So we have to be very creative on how we fund the company. I want to keep the product free for diabetics. GlucoSense is a free resource. And I believe in the long run, we'll solve for these broken healthcare dynamics and make it to the payers. If you make better decisions and you'll use less insulin, you'll have less highs, you'll have less lows, you'll not end up in the ER. But at the end of the day, we pick up the piece of candy or the donut or whatever it is that's going to make our blood sugar go on a roller coaster. The insulin pumps are reactive to that. Our management is reactive to that. So if we can get ahead of it, telling you what's happened to you in the past and how ready you are for the day, I think we can change a lot of behavior.
Knowing that the journey with device companies can also be challenging, who are you currently working with? I know you have Dexcom.
Yes. So we have Dexcom data, we have Abbott Freestyle Libre data, and then we have Whoop, Aura, Fitbit, Apple Watch, Garmin. I think we're integrating Ultra Human Ring pretty soon. And there's some other ones. They're pretty quick for us to integrate. Maintaining the relationships with the companies is definitely the most challenging. With some of the insulin pump manufacturers, hopefully we're getting closer to having official integrations on them. But the conversations and efforts have gone on for over a year.
Yeah. But to be clear, Jonathan, people who use an insulin pump, and because you didn't really mention like Omnipod or Tandem, they can use it even though their pump may not be integrated into your system. Is that what I'm hearing? Am I saying that right?
That's accurate. So the insights you receive won't really have reference to insulin unless you manually put it in. But the pump data is not going to come in right now. It could be in the next few months. It could be longer. We're in those conversations. We'll see where they go. But it's certainly feedback that we continually get from users of, gosh, I would love this if my Tandem was integrated. And yeah, it would be way better. It's more data in one place. But we have to do it compliantly. No backdoor methods. From a technical perspective, webhooks that are fetching your personal account credentials. It's got to go through their official APIs. And we just have scrutiny from so many people.
Oh, yeah. And I think that if you've been in the diabetes community long enough, you know of apps and companies that are not doing it that way, and they just get turned off in the middle of the night. So I feel your pain, but I can see that this is very frustrating, but you have to do it the right way. Can you talk a little bit about users? How's it going? How many users do you have? What are they saying about it? What do you think they like the best?
Yes. So we get users from multiple channels. So doing stuff like this, podcasts, social media. We are partnered with quite a few healthcare, with pretty much all the major healthcare systems in Atlanta. And we've more so started to make things more official and public towards the beginning of this year. The user growth has been good. It's interesting to see the kind of persona that gets onboarded. Seasoned diabetics, very skeptical. Type 1s who have been type 1 for 15 years. I mean, I'm one of them. I've tried every diabetes app out there and they all suck. They don't do anything for me that I haven't already thought of, or it's just like a logging tool. It doesn't help you be proactive. And we make sure that GlucoSense differentiates in that way because I know if you're going to use it, it has to be able to provide something to you that you don't have or solve a problem that you do have. I don't need an app that does another form of data analytics that's marginally better. That's absolutely not needed. So getting the skeptics, even though it is free to try it, most people seem to love it. That's an uphill battle in terms of user growth. The people who we really went with are parents, and we're simplifying the onboarding for parents because it's very confusing right now. So next couple of weeks, you'll see that. And newly diagnosed or people who've had it with kind of in the past 3 to 5 years, I'd say, like if you're in that window, there seems to be pretty good adoption. There's also this other kind of demographic of we have a cluster of users around like 40 to 60. I don't know why, but
don't
it
count
just
out
happens.
older people with technology. And I mean, 40 to 60 isn't exactly older, but
no, I would hope not.
right. But it's really interesting because I think that, I mean, I don't want to get on the soapbox here, but a lot of people seem to think like once you're 50, you're not going to use any kind of app or technology. And that's just so wrong. Quite often they're looking for more help. Is it for type 2 as well?
Yeah. So when you sign up, you choose type 1 diabetic, type 2 diabetic, pre-diabetic, or non-diabetic, and your algorithm updates to whatever you select so that the metrics you get are for your population.
Who's using it as a non-diabetic? Is that people who just like to wear CGMs and be athletic?
You would be shocked with how many users we have that are non-diabetics. Like you people are costing me compute and I'm having to pay for that to keep it free for everyone. So it's, but it's a great app. People love it. And
it's really interesting.
Yeah, I think the metabolic space is very interesting. And I think everybody should wear a CGM for a little bit just to learn a little bit about yourself. But I certainly don't think you need to be somebody who's wearing a CGM as a non-diabetic every day for like forever. It's cool to get some of the insights. We see a lot of our users who are non-diabetic figure out things that work for them. And then they stop wearing a CGM and they got everything they needed. They tweak their lifestyle and move on.
What's the big goal here? Is it everybody with diabetes you'd like to use this? Is it hospital systems? Is it people actually, right, insurers paying for it?
There's multiple goals. I think A1C is an outdated metric, a failed metric, and something that needs to change. High level, discovered in the 1950s, became the standard of care in like 1993. And I'm still judged by it every time I go to the doctor, even though it doesn't mean anything about how I manage on a day to day. So we would like glucose score to be the new standard of care. That is our biggest goal that we are working towards. The data we have internally shows that it can do that, but now it's the millions of dollars in clinical research to prove it. And we're working with healthcare systems to do that. We also are working to become a tool that is covered and free for everybody. So we have incredible, ambitious investors who see the opportunity the way we do, approaching diabetes market from a totally different avenue. But that also means a return for investors, and we need it to be a covered tool. As all products succeed in the market, the user should always feel like they're getting more than what they pay for it. So in this case, the user should, me or the diabetic should feel like we get everything out of it and are incentivized to use it to the point where the insurance company sees a reduction in cost in some measure that they give us a smaller percentage of as a CPT code or whatever for GlucoSense. That's not in the next couple of years. That is a long-term plan. And we have some other stuff that I'm going to choose not to talk about
all right,
for the sake of this audience, but looks like we'll be able to keep GlucoSense free for diabetics for the foreseeable future.
Before I let you go, how are you doing? I mean, it sounds like you have been going nonstop since the minute at least you got to college, if not before that. Are you doing okay?
I'm doing great. I've got a great team with me. Dating life could be better. Single. But yeah.
How do you manage diabetes? Do you use a pump? I assume you wear a CGM?
My dog's name's Dex. So I've used Dexcom for like forever. And I use a insulin pump. I kind of want to go back to MDIs for a little bit. I've been struggling with, I probably shouldn't say the brand of the pump I'm on, but the way it sits under my skin, insulin's just not being absorbed super efficiently. Every time I take a shot, it works great.
Mm.
I've got a pretty healthy lifestyle, so taking shots isn't something I'm worried about doing. But GlucoSense certainly helps me in my day to day, and I make better decisions because of it. I built GlucoSense to solve my own problems, which are also the problems of millions of other people. So
Very cool. And I assume available Apple and Android, wherever you find fine apps.
yes, iOS, Google, there's a web portal you can log in and sign up on. And remember, we're a startup. So if you see a bug or something you want, a feature you want, something you want improved, just message us. It's likely it'll end up in the app. This truly can be shaped by the community. The users we've had for months have helped shape this into what it is today, way past my vision.
That's really cool. And I know this is getting long. Off the top of your head, is there anything you can think of that a user decided that they really wanted that you put in?
A lot of it has revolved around like the way the insights and messaging work in the app. We had people complain a lot about not having good access to qualified providers. So we have registered dietitians that we partnered with a group that will be in the platform. Most people will have full coverage by insurance. The follower following feature in its current form wasn't something that I thought of. It was a way to share with parents in a way that's not invasive to the kids. And this was the solution that we came up with.
I like that. It's tough as a parent. I'm a parent who followed my son until he was 17 and then did not. And most people don't feel comfortable just kind of cutting it off like that. So that's great.
Yeah, it's a perfect in between.
Yeah.
Doesn't mean something bad couldn't happen that day. Full transparency. You can always go from a perfect blood sugar, take 5 units of insulin and bottom out and have a seizure. But it will at least give you the idea, is the day going
right. But to your
well?
point,
That's
if I'm 10 hours away, I'd much rather he be followed by people in the same building or nearby.
Yeah. Did your son go to college and go from 7s every day to 4s? You're not going to help him in the technical charts, but you could talk to him about, hey, can we make some better choices?
Interesting. You started this interview by talking about Mom's Night Out. I just have to say thank you so much for speaking at our Atlanta event. That was so much fun. And I know you weren't expecting to do as much as you did. So thanks for not running off the stage when you realized you weren't just doing a quick Q&A.
I didn't think we were going to be the focal speakers for the night, but it was a lot of fun. And it's really incredible, the community you built. It's in the niche of moms. I'm sure my mom would have loved to have had a community like that because she found another diabetic parent, but it's sparse and hard to find. So having those networks means a lot. And you could see it with everybody in the room.
Well, I really appreciate you coming. And thanks so much for sharing the story here. We will link up all the information. Jonathan, come back, keep us posted over the years, and all the best. Thanks for joining me.
Thanks, Stacey.
More information about GlucoSense, go to diabetes-connections.com, click on this episode's homepage, or just look in the notes wherever you are listening. And yeah, it was really funny in Atlanta because I didn't know this till after the event. Jonathan was part of a panel. It was him and another woman from Camp Kudzu talking about the transition from being a kid to being a young adult with type 1, so these moms could kind of look ahead and see what works teaching your kid independence. What do these young adults really think their parents did right? What do they wish they did differently? It was a great discussion. But poor Jonathan did not know that he was the whole panel, that he was there for the whole talk. He thought he was literally going to be on stage for 5 minutes. But the good sport that he is, he stayed and he did great. And he didn't even tell me till after. So Jonathan, thank you again. And Camp Kudzu, thank you again for all of your help. They really helped make that Atlanta event fantastic. And I will link up Camp Kudzu in the show notes. They are a wonderful camp that has different sessions during the summer and they have programming during the year. And their diabetes camp, I've probably mentioned this before, one of their sessions is right down the road in Georgia from where Benny, my son, went to regular diabetes camp for 4 weeks when he was little and 8 weeks when he became staff. So it was always nice for me to know that there was a diabetes camp a mile down the road just in case anything went wrong. Knock on wood. Nothing did. We did good on that. Thank you, as always, to my editor, John Buchanan from Audio Editing Solutions. Thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.